DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. I'm glad you joined us today. We're going to talk about digital dermatitis, and our guest will be Dr. Brian Lubers. We're going to talk about what can happen when it gets into a feedlot situation, how you can prevent it, how you can treat it, many different aspects of this crippling disease for cattle.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
Hey folks, welcome to the show. Brian, welcome back.
Thanks.
Always good to have Dr. Brian Lubers, who is the Director of Microbiology at the Veterinary Diagnostic Lab here at Kansas State University's College of Veterinary Medicine. And Brian, you've had some experience with digital dermatitis, not you personally.
Not me personally, no.
But had some cases, whether it's on dairies. But today we want to hone in on the feedlot situation a little bit. What exactly is digital dermatitis?
So it's papillomatous digital dermatitis. It has a whole bunch of names, actually. Strawberry foot rot, Montellero's disease, that's the guy that found it the first time. Hairy heel wart, any of those, we're all talking about the same thing. And what it is, it's actually a pretty new disease. It was first described in the early 1980s, which is a while ago, but in diseases, that's pretty early. We don't really know what causes it. We think it's caused by a bacterial pathogen. There's probably many conditions, so environment, the pathogen itself, the animal, that kind of play into whether an animal is actually affected or not. But we think it's a bacteria called a treponema.
Okay, so describe a treponema, because that doesn't sound like just a normal bacteria.
It's not. And probably the closest thing that most cattle producers would be familiar with, be relatively close to like a leptospire. Okay. It's actually in the same family as what causes trench mouth in people. So that's kind of it is kind of an unusual pathogen on the veterinary side.
So, I mean, trench mouth and hairy heel wart and things like this, is this captured in the environment? Is this something that, in the soil?
It probably maintains itself in the animal. So we need an infected animal to bring it into a new environment.
Okay.
But what we know about it, which is actually pretty little because it is a relatively new disease, is it probably persists in the environment for a long time. So once you get it into a place, moist soil will maintain this bacteria for quite a while.
Okay. And so, and that's what I was also going to say. When you hear heel rot or heel wart, trench mouth, things like that, it lends itself to moisture, or not necessarily an arid climate, I'm going to assume.
Not necessarily. And what we know, and is we're specifically talking about feedlot, is animals that are pasture grazing in large settings are at lower risk than animals that are confined, and we think that probably has to do with moisture and mud and things like that.
And so when typically I've always thought of digital dermatitis or hairy heel wart as more of a dairy.
And that typically is the case, that it was first described in Europe and the United States primarily in dairies. And so that's kind of and it was typically kind of started, most of the original research and case reports were coming out of kind of the large Western dairy. So originally we thought it was a large dairy herd problem, but now we know it's pretty much spread across the United States. And like you said, we've seen it in some feed yards and are seeing it increasingly in feed yards.
Yeah. Well, we're going to take a break. When we come back, we're going to talk more with Dr. Lubers about some of the clinical signs and what you'll see in the feet of these animals that get digital dermatitis or hairy heel wart. We appreciate you watching the show. We're going to take a break, and we'll see you right after these messages.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Tyson Beyer, a student at the University of Saskatchewan, recently received an Amstutz scholarship. As a fourth-generation rancher raised on a cow-calf operation, Tyson grew up in the cattle business, and it was natural for him to pursue an education in bovine medicine. After graduation, he plans to work in a large animal practice, then move into bovine reproductive technologies.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Brian Lubers. We're at Kansas State University, where Dr. Lubers serves as the Director of Microbiology for our Veterinary Diagnostic Lab. And we're talking about digital dermatitis or hairy heel wart or strawberry
foot rot.
I love all the names. They finally, the digital dermatitis sounds a lot more scientific. But anyway, let's talk about the clinical signs. So what am I going to see out in the pen, or is it going to be one animal? Is it going to be multiple animals? Does it,
Sure. And I think really what the challenge is how is digital dermatitis different from foot rot? Because those are probably the two closest things that a producer would see. And so if you're comparing those two, number of animals, with foot rot, there may be multiple animals affected at the same time, but they're probably all exposed at the same time. With digital dermatitis, you would expect to see a few cases up front, and then it kind of spread through that pen or even multiple adjacent pens. As far as lesions, the biggest thing, if you're looking at the animal from a distance, with foot rot, typically we'll see some swelling in that foot above the hoof. We generally don't see that with digital dermatitis. So the lesion is pretty much confined to the heels. That's why we call it hairy heel wart, and it's usually on the back legs. So if I'm kind of profiling a case of digital dermatitis, it'll be an animal that has a back foot that's affected. It will be not swollen, and it will be very, very painful. These lesions, when you touch them, these animals will pull back their foot. A lot of them in the advanced stages of the disease, they'll do what they call a toe tipping walk, so they'll just put weight on their toes. They won't put weight on the heels. But the lesions can be in between the front of the toes, so you may see some unusual, but the typical case will be back foot, very painful, and in what we see an increasing number of cases.
Yeah, well, and the painfulness has to be something that kind of differentiates as well. But as you mentioned, you have to pick up the foot.
Yeah, to really tell those two apart and to confirm that you have a digital dermatitis case, you have to pick up the foot. And if you have a veterinarian that you're working with that has seen these cases before, the lesions are pretty obvious, but it's always, there may be cases where you're either early in the stage of the disease or late where it's starting to resolve on its own, that the veterinarian may want to do a biopsy essentially, and we can then look for those treponines. Yep, just take a sample of the skin out. We'll send it into the lab. Like I said, we can do some special stainings and we look for those bacteria.
And does it smell as bad as like a foot rot?
Not typically. No,
okay.
No. The lesion, it's called strawberry foot rot for a reason, because it actually looks like a strawberry. It gets that kind of red. It's raised up. It'll have little kind of indentations like strawberry skin, and it looks like somebody put a strawberry on the back of their foot.
Cool. So, just in general, multiple animals, hind limbs, across multiple pins, different stages of the disease.
Very painful.
Very painful, and you got to pick up the foot.
Yeah. In dairies, one of the tests that we use for this disease is to actually spray the back of the foot with a hose, and if they pull their foot back from that kind of pressure, that's a positive sign for it.
Cool. We're going to take a break. Folks, after the break, more about digital dermatitis with Dr. Brian Lubers.
It takes vision, dedication, hard work. It takes knowing who you can trust. At Zinpro Corporation, we have more industry-endorsed research behind our trace minerals than any other company. Proof that our patented performance minerals help improve overall animal health and performance. Lots of companies make claims. At Zinpro, we generate results.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at beyondtheelevator.com. Brought to you by America's soybean farmers and their checkoff.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
TrueTest Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Yep. Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Brian Lubers. He is the Director of Microbiology at the Veterinary Diagnostic Lab at Kansas State University's D-Lab. We're talking about hairy heel wart, digital dermatitis, and so we've gotten through what causes it and what it looks like.
Right.
Now, what do? I got an animal in the chute with it.
Well, I think, when we talk about digital dermatitis, a lot of what we know comes from the dairy industry because they've been dealing with it a lot longer. And so the things that we know work are topical antibiotics. And so what they would use in dairies would be either for an individual animal, so a small number of cases, we'd take oxytetracycline, lincomycin, there's a couple others out there, and put it under a bandage, wrap the foot, put it on there and go away. Okay. The other thing with larger number of cases would be to make an antibiotic solution and put it in like the garden type sprayer. And when they lock up the animals for either a preg check or feeding or whatever, is to spray the back feet of the affected animals with that solution. Now, when we try to take that into a feed yard, the logistics get a lot more complicated. You know, we're talking about facilities that aren't meant to do those kinds of things. And so we really don't have good practical solutions for dealing with it in a feed yard on a large number of animals. Obviously, the individual animal, when you get the first couple cases, you bring them into the chute. They're in the chute maybe to even confirm that that's what it is. Then obviously those kind of measures, you know, oxytetracycline powder right there on the lesion, and send them back either to the hospital pen or the home pen.
Absolutely. So, yeah, it would be a slightly different situation. We don't have the back end of the steer looking at us 2 or 3 times a day where we could spray that foot. So treatment in the feed yard situation, we got to go get those animals out of the pen, and really that's one of those things that for me, when the animal can't compete anymore at the pen level, and they're limping, you know, bring them in to find out what's going on. But in this situation, probably better get on top of it sooner rather than
absolutely, yeah,
later.
Yeah, and when we first found this disease here at Kansas State in the feed yard setting, it was we thought we had a feed yard that thought they were having an unusual foot rot problem, and they weren't responding to the injectable antibiotics, which is kind of another hallmark. You know, there's not a lot of research, but what we know is a lot of the injectable antibiotics aren't going to be effective for this disease, and so we have to manage it some different way. So get on top of it early, manage it topically, the individual animal level. When really the other thing we take from the dairies for practical solution is foot baths.
Okay.
Yeah.
And so foot baths can be a good way of preventing it from going on the next animal.
And kind of managing larger numbers of animals, you know, as far as if we're trying to treat larger number of animals, foot bath may be a lot more practical.
What are we putting in the foot bath?
Oxytetracycline, lincomycin, zinc sulfate, copper sulfate. Actually, formalin also has been something that they've looked at for managing foot baths.
And I've seen it too, where you bring the pen out, put the foot bath in the drover's alley, run the group through there, run them back, going back to the home pen.
Yep.
Different things we can set up. All right, well, we're going to take a break. When we come back, we'll have our wrap-up with Dr. Brian Lubers. We're going to be talking about digital dermatitis in the feedlot setting. You're watching DocTalk, and we'll see you here after the break.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Hello folks, I'm Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Today's BQA Tip of the Day has to do with good quality cattle handling, low stress cattle handling, and good quality horsemanship. These are some new cattle here, and when we get new cattle in, we want to focus on several things. We want to focus on cattle acclimation and producing good cattle health. We often want to focus on the drugs and the shots that we can give to produce cattle health, but what we're doing here is more important than those things. We want to acclimate these cattle, spend time in the pen with these cattle each and every day, focusing on individuals, but also the pen as a whole, creating good, positive cattle movement using pressure and release techniques, also doing things like exercise with these cattle. We want to kick them out of the pen, we can take them down the alley, bring them back. We want to just give them something else to think about, stimulate a cough, stimulate positive health. That's our end goal. Thank you.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
I've always had an interest in care for the animals and their well-being. Really what we want to do is work hard to eliminate as much feedlot lameness or beef cattle lameness as possible.
How we feed a cow on a daily basis can not only have daily effects, but they can also have long-term effects on claw health, reproductive performance, mammary health, all of those factors as we look at the inputs and the response that the animal has to what we feed them.
When animals have adequate intake of effective nutrients, we take care of the immune system and performance follows. It's important that the consumers understand our dedication to the well-being of these animals.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to Doc Talk. Dr. Dan Thompson and Dr. Brian Lubers. Brian is the Director of Microbiology at the Veterinary Diagnostic Lab at Kansas State University's College of Veterinary Medicine. And we're talking about digital dermatitis. And as we left the break, we jumped into foot baths.
Sure.
So let's kind of wrap up with foot baths and the characteristics and how you use them and when you use them and things of that nature.
Sure, and like I said, the things you'd put in a foot bath would be antibiotics, zinc, copper, formalin, but it's probably worth talking about the downside of a foot bath. And when you talk about foot baths, and again we're translating a lot of this from the dairy side, but managing a foot bath is a lot more than just putting a foot bath in an alley and walking some cows through. All of those antibiotics, mineral supplements that we would put in that foot bath, all of them are deactivated by organic material, manure. Right. And so, keeping that foot bath clean becomes a very challenging proposition, especially when you're talking about tens to hundreds, maybe even 1,000 animals you're trying to get through a foot bath. So you either have to pre-foot bath with a wash, or you just change that foot bath very, very frequently. And then there's the environmental side too. We start talking about putting zinc and copper and antibiotics back into the environment.
And formalin.
In formalin, we've got all those challenges to face too. So we talk about digital dermatitis in a feed yard, and we don't know a lot about it, and it's just frustrating because logistically, it's one of our most challenging diseases to fight.
Well, and I picture the old West show, the old John Wayne show of them crossing the river and running them through the bath.
Something like that, yeah.
And just keep maintaining the solution where you want it. It can be a logistical nightmare.
Yep.
But anyway, the dairies are just much more set up to control it and use products like that. Maybe we should be looking at areas like the processing barn and things like that as well.
Well, and even with that, and it's probably, again, it's one of these things, we talk about it all the time. Get your veterinarian involved so you can talk about the specifics of what work in your specific farm, ranch, feed yard.
Absolutely.
Because there is no cookbook solution for this disease. We can talk to feed yard A and B, and we'll come up with two completely different plans for those yards. So
And one of the things that you said during the break is that when you get it and you get it into your environment, it's hard to control, it's hard to prevent, and it's probably going to come back.
Sure, and we talked about treatment a little bit, and the treatments, the individual treatments, the topical treatments. There's been enough research. We know they work, but the problem is the disease comes back. There's just the animals don't have good immunity to this specific bacteria, and from what I've seen from dairy studies, somewhere between 50 to 80% of the animals will get a lesion again 2 months later or more. So,
well, thanks a million for being on the show.
You bet.
It was a great show. As always, Dr. Brian Lubers, Director of Microbiology here at Kansas State University. If you want to know more about what Brian and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Remember, always work with your local practitioner. Thanks for watching this morning. We appreciate you coming and spending some time with us. I'm Dr. Dan Thompson. You've been watching DocTalk, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.